product we've been talking about is called a SphenoCath. It's made by Delore Technology. It says SphenoCath. You can tell that this is a small plastic device. And what's unique about this device is that it's plastic, but it has a little purple end that angles down. And so what happens is when you get inside of the person's nose, you pull this little device back, and that makes it straight. And then when you get inside the nose, you push it down, which angles it down. So what's important about that is that we have three little shelves, if you will, in our nose called the inferior, middle, and superior meatus. And the idea is that those are little shelves that go back to the back of the nose, and the nerve complex that we're trying to treat, called the sphenopalatine ganglion, is just behind the middle meatus. So because of that little angle that this makes, it shoots the lidocaine down across the table, and it drops right on top of the sphenopalatine ganglion. And so because of that, we're getting great results. We're seeing somewhere in the neighborhood of 8 or 9 out of every 10 people we inject that are responders. There are some other competitors on the market, and they have different meatuses that they utilize to get the medicine to the location, and so they're not as effective as what I'm finding in my practice. So the SphenoCath is this little plastic device. It's really simple. We start out by taking just standard Q-tips and dipping them in viscous lidocaine, which is this right here, and when we just place that into each nostril, and we go down to a natural stopping point where we feel the catheter or the Q-tip stop, and we just let the person sniff in as much of the viscous lidocaine as they can, just to kind of anesthetize the nose and get them ready for the treatment. And then we pull 2% lidocaine into a syringe. It's very simple. And then we attach the syringe to the catheter and inject into each side of the nostril about 1.5 cc's. And that is the procedure. It is that quick, it is that easy. I know it sounds simplistic and too good to be true, but it literally takes about a minute. And what's remarkable to me is that the results are so extraordinary for such a simple procedure. So, you know, for a guy who spends a lot of time in the OR doing hour and 2-hour cases trying to get good results on patients, doing something that's so safe and so easy in the office has been a great addition to practice.